Good morning. My name is Jeff Schmitt, and I'm a scientist and musician and interested in a number of different things. And the idea that um, I believe is worth sharing with the TEDx audience this year is a model that I'm developing for transformative healthcare based on a anchor principle called the ecology of wellness. And my vision is that transforming the American healthcare system is not an institutional matter. It's not a matter of legislators in Washington, locking themselves in offices and coming up with new solutions based on law and policy. Rather, it's an issue related to rethinking who we are in relationship to ourselves, to our communities, to nature, and to spirit. These four aspects really embody this concept that I'm terming the ecology of wellness. So we need a place and a framework to develop optimal solutions. Right now, one can look from the systems perspective at the healthcare system as a suboptimal solution. We have a number of viewpoints that permeate the healthcare landscape that I believe are feeding the inability for us to really have effective and affordable health care. And what I'd like to explore in my talk is some of those beliefs and ideas and some historiographic material as to how we got to where we are. Here are a few examples of what I'm speaking of. First is the view of the human being as a machine. When you get sick, unfortunately, the prevalent viewpoint is that you're very much like an automobile that needs to go to the mechanic and get repaired. But history has told us, and a myriad of new research, mostly in a field called systems biology and also complexity theory, tells us that we're really not simple machines, that other aspects of being human need to be addressed in order for true wellness to be attained. So that's the first, the mechanistic, the prevalence of the mechanistic viewpoint. Another one is this concept of the cult of the individual. The prevalent viewpoint in biology is preoccupied with individual organisms, each autonomous and separate. But I believe the reality is that it's very hard to define truly where the individual ends and environment begins. We're truly, each and every one of us, a continuum between ourselves and other. A really good example of that, I think, is this project called the Human Microbiome Project that is going about the task of mapping all of the microorganisms that live symbiotically with us and actually keep us alive, especially when you think about the microorganisms in your gut that help you digest food and get nutrition. The question is, in that context, are you as an individual your body plus those microorganisms, or are you yourself without those microorganisms? We are a true continuum with nature, and the more we start to embrace that viewpoint, I believe the more insight we'll get into how to transform our relationship to ourselves, to nature, to spirit, and to other, the four key elements in this ecology of wellness. In addition, there's also a key issue around the patient-healer divide. If we go back to that analogy of, I'm an automobile that's not running right, I go to the mechanic doctor to get myself fixed. Under that paradigm, there's a hard and fast limit between the doctor and the patient. But if you look at how medicine has been and healing has been conducted in cultures up until the modern age, that divide didn't exist. The healer participated in all levels of the patient's healing. And another element that I think is extremely important in this ecology of wellness is to re-explore and redefine what that divide is, and indeed should there actually be a divide. Lastly, and also extremely critical, is our separation from environment and our separation from nature. We spend, for the first time in history, we spend most of our time in built environments, unnatural environments. This is absolutely unorthodox in the scheme of human evolution and human biology. And in order for us to rethink healthcare, this is another dimension that we must address. So in my proposed TED Talk, I will lay out the vision for the ecology of wellness, how that can be actualized and reduced to practice, and also I will touch on various key points that and beliefs and practices that are contributing to our general inability to treat the whole person and to achieve true wellness in the industrialized world. Thank you very much.